Hello everyone, I am Dr. Rahul Chirag, a consultant physician at Care Hospitals, High Tech City and Medics Healthcare, Nanakraguda. Today we would be briefly speaking on adult immunization. So, what is adult immunization? So, adults also require vaccines once they receive vaccines during your childhood. So, that is to boost the efficacy of the vaccines whatever you have received during your childhood. So, what do vaccine do? Vaccine actually trigger the immune response in your body to generate antibodies to fight the infections. So over the time, there is a process called immunosenescence. As age advances, you would lose the immunity over the time. So that is the reason you require vaccination even in adults. So as such, there is no proper consensus available in India. So we follow certain guidelines, that is API guidelines, Association of Physicians of India guidelines, as well WHO guidelines and Advisory Committee of Immunization Practices by CDC recommendation. So 25% of the mortality in India is due to infectious diseases. So the infectious diseases in India plays a huge role. So the burden of infectious diseases can be reduced up to some extent with the help of vaccination. So the prevalence of non-communicable diseases is increasing as the years are passing. Even a simple influenza in patients with obesity or a history of bronchial asthma or even diabetes or hypertension or any other comorbidities is resulting in hospitalization and even sometimes death of individuals. So all this could be prevented with the help of vaccination. Vaccination not only prevents the infectious diseases but also helps in preventing the cancerous conditions. Let's take for example human papilloma virus vaccine, so which helps in preventing infection as well as cervical cancer. And for instance, hepatocellular carcinoma, common cause could be hepatitis B. So hepatitis B vaccination could help in preventing hepatocellular carcinoma up to some extent. So a burden of cancerous conditions also can be prevented with the help of vaccination. So there is a lot of scope for vaccination in adults as well, not only in the childhood. Common vaccines what we need to take even during adults: influenza, pneumococcal vaccine, hepatitis B vaccine, hepatitis A vaccine and typhoid vaccine in food handlers. So let's go one by one. Influenza vaccine. Influenza vaccine is needed for all the individuals in adults. So the virus mutates every year. So that is the reason you need to take influenza vaccine every year. So this vaccine is indicated for all the individuals. It prevents the severity of the infection, and it is also indicated in pregnancy conditions. So any pregnant female in second and third trimester is advised to take a influenza vaccine. And influenza vaccine can also prevent severity of the disease up to some extent and even prevent hospitalizations. And the next vaccine what we need to take regularly is pneumococcal vaccine. Pneumococcal vaccine is not a regular vaccine. It is only indicated in adults aging more than 50 years or persons with comorbidities like diabetes, hypertension, obesity and respiratory illness, previous respiratory illness. Pneumococcal vaccine is indicated. There are two pneumococcal vaccines available, 13 valent serotype, another one is 23 valent serotype. So these two serotypes are to be taken at a gap of 1 year. So PCV 13 is administered in the first year, followed by a gap of 1 year. PPSV 23 valent is administered. So this helps in reducing the severity of infections as well as hospitalization, and it can also reduce the mortality as well. And the next vaccine what we commonly advise is MMR for people who are planning to get pregnant. So MMR can actually prevent measles, mumps and rubella. So people who are previously immunized, there is no need for MMR vaccine again. So people who are planning to get pregnant, since MMR is a live vaccine, once you take vaccine, you should be avoiding pregnancy for the next 1 month. So it takes, since it's a live vaccine, you are advised to not to be pregnant for the next 1 month. So it can prevent rubella condition, like in normal individuals, rubella is simple condition which can resolve on its own. But in pregnancy, it can cause congenital rubella syndrome, which can be very threatening sometimes. And TDAP, that is tetanus, diphtheria, and pertussis vaccine. So TDAP is usually advised from the age of 18 years till the age of 64 years. Every 10 years, you need to be taking one dose of TD vaccine along with one dose of TDAP vaccine. Tetanus, diphtheria, pertussis vaccine is advised even during the pregnancy in the second and third trimester, so that your antibodies are boosted and have some efficacy even in the newborn baby as well. And there are other vaccines like varicella vaccine. Varicella vaccine is usually not indicated in adults who have developed varicella in the past or taken immunization in the past. If you haven't taken varicella vaccine, again you can take 2 doses of varicella vaccine, which helps in preventing varicella, that is chickenpox. It is also indicated in patients who are planning to get pregnant. That can also prevent severity of the chickenpox in pregnant females. And the next common infection what we see is zoster. Zoster is actually a reactivation of the chickenpox, which is seen in patients who are having immunocompromised state or even any comorbidities like diabetes. So zoster vaccine is indicated in individuals who are aged 60 years with a single dose of vaccination is advised. And vaccination for healthcare workers like hepatitis B is mandatory. Hepatitis B, there are 3 doses, which is very cheap and has shown good efficacy in the past as well. So you need to take 3 doses, that is 0, 1 and 6 months. That will prevent you from infection as well as hepatocellular carcinoma, as I have discussed. And again, hepatitis A vaccine. Hepatitis A vaccine is commonly indicated in people who are traveling abroad. So hepatitis A vaccine can prevent hepatitis A infection, and it is also indicated for food handlers. And we have other vaccine, typhoid vaccine. Typhoid vaccine is also indicated for food handlers. So whenever there is an outbreak or people traveling to countries with infected, where there is a lot of incidence of typhoid, so we advise typhoid vaccine. And again, some vaccines like people who travel abroad for higher studies are advised, like meningococcal vaccine. Another one is Japanese B encephalitis and yellow fever vaccine are usually indicated in persons who are traveling to African countries. And meningococcal vaccine which is available as Menectra is usually advised for people who are traveling to US for higher education, is advised to take the meningococcal vaccine. And there are other vaccines, polio vaccine as well, which we have taken. And as of now, we have seen the polio is almost eradicated in our country. And we have achieved even a smallpox eradication as well, with the effect of effective vaccination throughout the country. So vaccines can actually prevent many infections, which can lead to life-threatening conditions sometimes. So the take-home message would be vaccination, which should be a priority even in adults, should be discussed with your physicians.